Hi, I am Peter Glowicki from Mayo Clinic, Editor-in-Chief of the Journal of Vascular Surgery. I am happy to introduce 4 excellent papers from the 2022 March issue of the JVS. Each of these are freely available to read or full-text download for the next 2 months. The first article is also the editor's choice and the CME article for this issue. It is entitled Incidence, Predictive Factors and Outcomes of Intraprocedure Adverse Events during Fenestrated-Branched Endovascular Aortic Repair of Complex Abdominal and Thoracoabdominal Aortic Aneurysm. This was written by Dr. Emmanuel Tenorio and colleagues from Houston, Texas and Rochester, Minnesota. This is a retrospective review of the data of 600 consecutive patients who underwent fenestrated-branched endovascular aortic repair between 2007 and 2019 at Mayo Clinic in Rochester, Minnesota. 18% of the patients had intraoperative adverse events. These were aneurysm-related in 9%, access-related in 8%, and graft-related in 1%. Risk factors for intraoperative adverse events included female sex, smaller renal artery diameter, and more extensive aneurysmal disease. These adverse events resulted in more secondary interventions and in target artery instability. The next article this month is entitled Perioperative Outcomes of Carotid Endarterectomy and Transfemoral and Transcervical Carotid Artery Stenting in Radiation-Induced Carotid Lesions. It was written by Dr. Paola Battarse and colleagues from Bronx, New York, and Toms River, New Jersey. In this Vascular Quality Initiative study, 1,927 patients with radiation-induced carotid artery stenosis underwent either transcarotid artery revascularization, TCAR, or transfemoral carotid artery stenting, or carotid endarterectomy. The patients who had undergone transfemoral carotid artery stenting were more likely to have had symptomatic lesions and prior stroke. The composite outcome of stroke, death, and myocardial infarction occurred in 3.2% of TCAR patients, 11.2% of transfemoral carotid artery stenting, and 11.1% of carotid endarterectomy patients. And this finding was statistically significant. However, no differences in the individual outcomes were noted for any of the procedure. TCAR exhibited the lowest odds ratio for cranial nerve injury. This was certainly a very interesting paper, and I recommend you to read it. The third paper I would like to introduce is entitled Timing of Endovascular Repair Impacts Long-Term Outcomes of Uncomplicated Acute Type B Aortic Dissection. It was written by Dr. Dongqiao Xiang and colleagues from Wuhan, China. In this retrospective study of 238 patients with an uncomplicated acute type B aortic dissection underwent TVAR. The 30-day mortality was 1.5% in the acute TVAR group when patients underwent TVAR within 14 days after onset of symptoms, and it was 0% among those who were operated on later. The incidence of 30-day adverse events was 16.8% of the acute group and 6.9% only in patients who were operated in the subacute phase. There was no statistical difference in 5-year all-cause mortality, nor was a difference in aorta-related death. These data suggest that performing TEVAR in the subacute phase of acute type B aortic dissection may be the preferable option. The final article this month by Dr. Todd Berland and co-authors is an international study. It is entitled Percutaneous arteriovenous fistula creation with the 4 French wavelength endo-AVF system. This is a review of pooled data of 120 patients from 3 prospective multicenter single-arm studies who underwent percutaneous arteriovenous fistula placement using the 4 French wavelength system. Primary and secondary patency rates were 71.9% and 87.8% at 6 months, respectively. Time to maturity averaged 41 plus minus 7 days. Reinterventions were performed in 19.2%, and device-related serious adverse events occurred in 3 patients, 2.5%. Procedure-related serious adverse events occurred in 5.8%, but there were no arterial or venous access complications. These were just 4 of the many excellent papers we published in the March issue of the JVS. Please read our journals, follow us on social media, and send us great manuscript that we can publish. Thank you for watching, and see you next time for the highlights of the April issue of the Journal of Vascular Surgery.